with those structures for finding other structures, ligamentous as well as musculotendinous. First thing, we're going to come down, just like we did with the humerus, we're going to come down the femur until we find the lateral epicondyle and the medial epicondyle. From that point, we can go further down and find the head of the fibula. We'll come across to find the tibial plateau, go down along this ridge, which is really not a tubercle as much as it is a ridge, to find Girdish tubercle, which the IT band attaches to. It actually turns into or merges with the tibial tuberosity. On the medial side, we will actually be switching over to the top side of where the supracondylar ridge is. On the top side, there's a little tubercle up top. It's called your adductor tubercle. Other than that, that's pretty much the structures for the bone. We will look at the patella separately later on when we measure the Q angle. All right? Just hold on to that. So, I just simply come down the thigh until I feel, oh yeah, there's two bumps. Those two bumps are my medial and lateral epicondyle. From that point, I'm going to come down, straight down, and find the fibular head. The fibular head, I'm going to go just above it, and we're going to find the tibial plateau on both sides. And that tibial plateau and the head of the fibula, in between those, there's a ridge, more than a tubercle. That ridge right there is the Girdish tubercle. That coincides and flows into the tibial tuberosity. Good? Two things that are commonly mistaken for each other is the Girdish tubercle and the fibular head. Don't get those mixed up. The Girdish tubercle actually comes up until you feel it merge with the tibial plateau. The fibular head is actually more posterior and lower down, inferior than you think it is.
So about 2 fingers?
Yeah, about 2 fingers. All right, on the medial side, let's switch legs so they can see. On the medial side, once I come down and find the obvious bony landmarks, which is the medial epicondyle, I'm going to go up, and there's a bump kind of on the top side. That is your adductor tubercle. That's going to be important for palpating the tendon of the adductor magnus, just below the adductor hiatus. What goes through the adductor hiatus? The femoral artery, which then once it goes through, turns into the popliteal artery, or popliteus. Popliteal artery. Popliteus is a muscle.
So from the medial epicondyle down, that would be the
no, medial epicondyle up.
Up, okay.
Or superior, up towards the top. Switching to ligaments, we are going to be looking for 3 ligaments that we can actually supposedly touch through skin. The first one being the lateral collateral ligament. We're going to use the lateral epicondyle as a landmark, the fibular head as a landmark. In between those two is the LCL, lateral collateral ligament. Good? If you cross your leg, go ahead and cross your leg like this. It sticks out like a sore thumb. Just find your fibular head, come superior. It's about the size of a small or skinny pencil. So find the fibular head, come up. Very tendon-like. Feel it? Good. Medial collateral ligament. Let's put this one down. We're going to find the medial epicondyle of the femur. Go down to the condyle of the tibia. Condyle is just the whole side. And in between there, there's going to be a firmness in the joint space. One of the ways we can do that is palpate the plateau of the tibia, and you can stick your fingers in. I stick my fingers in, stick my fingers in, stick my fingers in. As I come around to the medial side, all of a sudden I can't stick my fingers in anymore, so it actually starts right there and ends right there. That's very, very firm, and that's, but not firm, not hard like bone, but firm. There's my tibial plateau. I stick it in. Oh, it stops sticking in. And between the medial epicondyle and the tibia, across the tibial plateau, is my medial collateral ligament. Good? It's very flat and very wide, unlike the lateral collateral. The PCL and ACL, we are not, oh, forgot the other one that we can supposedly touch, is along the tibial plateau. What sits up on top of the tibial plateau? On top. That means here's the tibial plateau. What sits on top on the inside?
Meniscus.
The menisci. So we will be able to palpate directly the anterior horns of the lateral and medial meniscus. It just means here they sit.
The coronary.
This would be the anterior horn. This would be the anterior horn. So we can just push in there, and we're not really feeling anything except indentation, but that's where the coronary ligament is. If that has been disrupted or torn at all, that will be